Good morning. My name is Joachim Teotonio, and I am 63 years old and resident in Mississauga East. I have colorectal cancer, metastatic to the liver, stage 4. I was diagnosed in July 2004. Let me begin by showing you receipts in the amount of $40,386, all these, which I pay for the drug Avastin prescribed by my oncologist when no other drug would be nearly as effective to ameliorate my condition of colorectal cancer. When the referred drug was recommended to me in May of 2006, I was informed that it was not funded by the Ontario government. I was surprised and immediately made inquiries to the ministry. I was told that this particular drug was not and is not prescribed for or administered to anyone in the province except in approved clinical trials. In sum, I could not get it unless I pay for it out of my own pocket. Without Avastin, a drug recommended by Cancer Care Ontario for my disease, my options were very limited. I weighed the pros and cons and decided to arrange the funds to buy this drug on my own. I started to take the infusion of this drug in June of 2006 in a downtown Toronto private clinic until November of 2006. Needless to say, I was forced to pay out of pocket, which I did not have, when Mr. George Smitherman's office failed to assist me. It should be plain for all to see, patients, health practitioners, social workers, elected authorities, and many others, that it's bad enough to have this terrible disease without having to worry about drug accessibility. I cannot accept the fact that this government is denying me a right of accessibility to which I and every Ontario citizen is entitled to. It is not only morally wrong, but it is ironic and unacceptable that our wealthy province is adopting health policies contrary to other jurisdictions in this country. These policies encourage discrimination among its citizens. I'm here today to ask Mr. Smitherman to recognize and approve the funding of the medication that benefit cancer patients and reimburse me the amount of $40,386, which I paid a private clinic in Toronto. Thank you for allowing me to voice my concerns. Thank you.
Hi, my name is Antonia Codaspodi. Mario and I used to feel proud that we lived in Ontario, and now that has changed. We believe it is totally unacceptable for cancer patients not to have access to fully funded newer cancer drugs that can save and extend their lives. It is time the Ontario government be held accountable for the disparities that exist between Ontario and other provinces in providing access to newer cancer drugs. Accessing newer cancer drugs should not be dependent on your personal wealth. It is deplorable that people are being told that if you have money, you can go to a private clinic and access a drug that will save your life. Cancer patients deserve an investment in life-saving treatments. Patients with any other disease are given appropriate treatment care without charge. That is what our Canada Health Act promises to all Canadians. Why is this different in Ontario? Why can't cancer patients in Ontario get access to the newer cancer drugs they need? We are not here to criticize how this could have happened in Ontario, but rather demand a solution. Let me repeat the facts. Ontario is the second worst province in Canada in providing access to fully funded newer cancer drugs, and the worst in providing access to PET scan imaging. Health Canada has approved 24 newer intravenous cancer drugs. Out of these 24 newer cancer drugs, Ontario fully funds only 4. However, if you lived in British Columbia, you would have access to at least 20 fully funded newer cancer drugs. In Manitoba, you would have access to 17, and in Quebec, 15. Why is Ontario so far behind? There are 10 other newer cancer drugs that are only provided in Ontario if the patient satisfies 31 different restrictions on eligibility or pays for the drug. Ontario cancer patients face more restrictions to access newer intravenous cancer drugs than anywhere else in Canada. This is totally unacceptable. Furthermore, Ontario fully funds 6 PET scan imaging for every 100,000 people, while Quebec, our next door neighbor, fully funds 209 of every 100,000 people. What do we want from Ontario leadership government? We want parity with British Columbia for fully funded newer intravenous cancer drugs. We want parity with Quebec for fully funded PET scan imaging. And we want it accomplished by the end of 2008. I know you will agree with me that such an accomplishment would make us proud to say we live in Ontario. Ask your candidates how they plan to make this happen. If you would like to support the Ontario Citizens Cancer Coalition, go to our website, www.nomorewaiting.info, and sign our petition.
My name is John Kalachi. I am 43 years old, happily married with 3 children, ages 6 to 11, and I sit before you today as a colorectal cancer patient, mortified at the province's state of our healthcare system as it pertains to accessibility to life-saving hospital-infused cancer drugs. My cancer journey began 3 years ago in September of 2004. I went to see my doctor for some observed rectal bleeding. I was reassured it was merely a colonic tear and then proceeded to wait 4 months before receiving the most horrific news of my life. You have cancer and require surgery. 2 months later, I had the right lobe of my liver surgically removed, which was riddled with plum-sized lesions. 9 months of intensive chemotherapy then followed. In March of this year, I was diagnosed with a reoccurrence of the disease and have since then resumed chemotherapy. Shortly after my reoccurrence, I have been informed by my doctor of a first-line cancer drug that is recommended for my disease in Ontario, but is unfortunately not funded by the province. Patients are expected to pay for the drug if they wish to access it. The drug is called Avastin. I also learned that Avastin is indeed fully funded in British Columbia and made available to every patient afflicted with cancer for the purpose of either offering a cure or extending their lives for as long as possible. In July, I was informed that I have ceased responding to my treatment and that the disease is progressing. As a result, I am now traveling weekly to Amherst, New York to access a treatment which has been proven effective in saving and prolonging life in patients with colorectal cancer. The drug is Erbitux, and it is not available in Ontario. This is reprehensible, not only to me and my family, but to every cancer patient and their respective family in Ontario. This province is founded on so many just like myself, who after being in years of good health have blindly and faithfully placed their trust in a healthcare system that chooses to fail them at a time when it is needed the most. Cancer patients should not be fraught with the additional stress of funding costly cancer treatments, while already faced with the overwhelming burden of this catastrophic disease. Nor should they be traveling weekly to the U.S. to have their cancer treatments infused by U.S. doctors. These are additional burdens cast upon Ontario cancer patients by a government who chooses to place cost restraints above and before the health and welfare of its cancer patients. Most recently, I asked my doctor for a PET scan. He replied yes, but I would be required to pay for the test out of my own pocket at a cost of $2,350. We need to expand our focus, and public funding needs to take place so that the needs of multiple type cancer patients become met by receiving the standard of care to which every one of us is entitled. I am asking that the Ontario government, which has collected well over $2.5 billion in healthcare premiums, take a leadership position in Ontario for providing cancer patients access to new intravenous cancer drugs and accessibility to PET scan imaging. I fully support the Ontario Citizens Cancer Coalition campaign in association with Card 50+. Thank you.